Is there a cure for glaucoma? If you're wondering about this question, you're not alone. Hi, I'm Dr. Nagori. I'm an ophthalmologist and a glaucoma specialist, and you're watching the iFacts.com channel. Now, before we talk about the types of glaucoma that might be considered curable, it's important to understand that there are many different types of glaucoma. Now, one of the most common types is called primary open angle glaucoma. And while it is not curable, it is very, very treatable. In fact, when primary open angle glaucoma, POAG, is diagnosed early and treated early, the chances of losing vision are much lower than if the disease is found at a later stage. Now, there are some forms of glaucoma that can be very effectively treated, but we don't typically refer to them as curable because the patient still is going to require chronic monitoring and they may need to go back on medication at any point in time. Furthermore, if the optic nerve was already damaged from the initial insult, then it's possible that that patient does have some damage that would now put them in the category of having glaucoma. Let's take a look at some examples. So there is an entity called Phacomorphic glaucoma. Phaco stands for lens and morphic means change. And what is happening in this disease is that the lens of the eye has developed a cataract. And in that situation, the cataract has become so large that it is actually impeding drainage from the eye. And that means that the pressure in the eye is getting higher. And now the treatment for phacomorphic glaucoma is to actually have cataract surgery. So essentially, if you have cataract surgery, your phacomorphic component of the glaucoma is removed. However, in these patients, the glaucoma damage may have already been done. And so if the nerve is inherently weak now because of that, this patient is still going to require chronic monitoring. So it's not necessary that we've cured the disease, but we have cured the inciting problem. Another situation where we can solve the problem that's leading to glaucoma is a situation called narrow angle. Now, there is something called anatomically narrow angle and another entity called narrow angle glaucoma. As the name implies, when someone has narrow angle glaucoma, that means that the damage has already started to happen. In an anatomic narrow angle, it just means that the anatomy of the eye puts the patient at risk for that type of glaucoma. So by changing the anatomy of the eye, which we can do through a laser procedure, and sometimes also cataract surgery can help in these situations, we're solving the inciting problem. However, these patients also should continue to be monitored because just because the narrow angle has been solved doesn't mean that these patients won't go on to develop other types of glaucoma later in life. So overall, no, glaucoma is not a curable disease, but it is a very highly treatable disease. Early diagnosis and detection matter a lot. So it's really important to get screened and make sure that you don't have early signs of glaucoma. Now, in some situations, patients can actually get off of their glaucoma medication. This is if we do MIGS procedures and they're successful during cataract surgery. There's another video about this that you can look into on the channel, which is labeled glaucoma treatment. And there's ways to do lasers so that patients can get off of their chronic medications. It doesn't work in all cases, but the glaucoma in those cases is not cured. It's just been treated enough that the patient is not on medication. So in the other cases of narrow angle and phacomorphic glaucoma, yes, we are technically removing the inciting factor, but if the inciting factor has already caused damage, then that patient still is going to need chronic management and long-term follow-up. In general, we like to follow all our patients at least every year just to make sure that they are not having future problems from any damage to their optic nerve. Be sure to like and subscribe below so that you can stay up to date on all things related to eye health. Thanks for watching.